So, how many of you know that there is a disparity in how African Americans access mental health treatment as compared to white Americans? How many of you are familiar with the relationship that African Americans have with their barbers and stylists? I bet you're probably wondering, what does one thing have to do with the other, right? Doesn't seem to connect, doesn't make sense. But today I'm going to talk to you about a really creative program that we developed at Community Care that we really, it's a community engagement initiative where we had barbers and stylists in mind and working with our members to really increase the access to mental health services. And it's my baby. It is really my baby. So first, let me tell you a little bit about who we are at Community Care. So Community Care is a Medicaid behavioral health managed care company. We are contracted to manage care in 43 of the 67 counties in Allegheny County, and we're a wholly owned subsidiary of UPMC Insurance Services. And basically what we do is we provide customer service, we do treatment referrals, and we do care management. You don't need to hear all this other stuff on my slide. So today I'm just going to talk to you a little bit right now about African Americans or Black people and behavioral health. And I'm probably going to just use the word Black because I won't get tongue-tied saying African Americans. So, Blacks and behavioral health. First of all, Blacks experience mental health crisis at the same rate as the general population. However, only about 1 in 3 who actually need services get it. Mentally ill African Americans tend to be sicker than the general population, so they experience more disabilities, they experience more chronic diseases, higher rates of inpatient services instead of outpatient services, and they have more barriers to seeking treatment. African Americans, when they do actually seek treatment, they often receive poorer quality of care. In addition, when we look at substance use disorder, African Americans die at a higher rate than any other race or ethnicity of opioid deaths, opioid overdose. So in addition to the disparities, there's also stigma right within the African American community. Black people often think that therapy is just for white people. We don't do that. We don't go to therapy. They see therapy as a sign of weakness. It is so embedded in our culture to feel like we are strong and we can handle this, we got this, we don't need any help, that we see it as a sign of weakness. We often can hear it, and anybody that's African American here can probably attest to this, that we don't air out our dirty laundry. Most of us have heard our parents say, what happens in this house stays in this house. And when you talk about mental health, the first thing you're probably going to hear is, I'm not crazy. I'm not crazy. They think of mental health as being crazy. And then there's also a general sense of distrust in the African American community against the healthcare system. And I'll talk a little bit more about that in a little bit. There's also a misunderstanding of mental health. Many African Americans don't even recognize the signs and symptoms of mental health. They might not understand the fact that, that they're feeling sad and that they're not eating and they're losing weight and things that used to interest them don't interest them anymore. They don't recognize that as a fact that this might be depression. Oftentimes they think, as I said previously, they think of depression as a sign of weakness. It's just the blues. You need to shake it off. You'll be okay. African Americans are more likely to seek help from their family and their friends, and also their pastors and other, religious leaders, instead of going and seeking professional help. And there's nothing wrong with that, but sometimes we need to do that and seek help. And this lack of education often leads to African Americans just not going and seeking treatment. So it increases, it's one of the other barriers to seeking help. So why did we start this program that I'm going to talk to you about? Because of systemic racism in medicine against African Americans, we had to acknowledge that over the years, African Americans have been subject to things like just brutal experimentation. We've all heard of the Tuskegee experiment, right? That's not the only one. It's very popular. Everybody knows about that. But many other terrible things have happened to Black people when it comes to medical experimentation. Black people are often overdiagnosed in mental health. For example, Black men are often overdiagnosed as schizophrenic. Sometimes they're over-medicated, they're disrespected and mistreated. There's often a denial of service or delayed services. They did a study right here in Pitt where they talked about maternal health with Black women and how Black women die in childbirth more than anybody. Oftentimes they're not believed. When they say that they're having problems or things are going wrong, oftentimes the doctors don't believe them. So there is a mistrust of the healthcare system, but I think it's rightfully so. African Americans, because of these things, are often less engaged in the the behavioral health system. But guess what? This is why I talked about barbers and stylists. Even though African Americans do not trust the healthcare system, who they do trust are their barbers and stylists. Barbershops and beauty salons in many Black communities are the hub of the community. When we interviewed barbers and stylists for this initiative, they talked about how they know everything about their clients. Their clients talk to them about their kids graduating, new relationships, all the way down to the fact that they're experiencing hemorrhoid problems. So they know everything about their clients. And they really are trusted. And for many people, they really look to their barbers and stylists to talk to them and share their deepest secrets. Some people can't wait to get to their barbers and their stylists to talk about their issues. And for some people, that's the only quote-unquote therapist that they ever talk to. So the goals of Our Hair, basically, I'm not going to go through all of this. Basically, what we wanted to do is just really come alongside with and partner with the barbers and stylists because they're already doing the work. But we wanted to partner with the barbers and stylists, give them more tools for their toolbox so that they could talk with their clients about behavioral health service. And our goal was to really begin to see a decrease in the disparities that African Americans experience in seeking mental health treatment and seeking early intervention and prevention services. So that's the overarching goal of the Our Hair initiative. So exactly what is Our Hair? First of all, Our Hair stands for Health Access Initiative and Recovery. And basically what we did is we had a goal, and it started out just in Allegheny County, but I'll talk to you how we've expanded since then. We started it in 2022, but we wanted to train 25 Black and brown barbers and stylists within the Black community, and we wanted to train them on recognizing the warning signs and symptoms of behavioral health issues. We wanted to train them on how do you talk to your clients when you recognize these things as problematic as they're talking to you, and then how to link them to resources. What we did is we paid the barbers and stylists a small stipend for their participation in the trainings. In addition to training the barbers and stylists, we provided 6 months of follow-up consultation with them. And in addition to that, we developed a wellness concierge line. It's a special phone number that is designated just for this initiative where they could call in and one of our customer service reps would be able to link them to resources and services that they needed. And then in addition to that, we also have what you call community health workers, and they go out and they visit the shops periodically and they share resources with the barbers and stylists around what we call social determinants of health. What they are your basic needs like transportation, food, clothing. And even though those things aren't mental health related, they are things that affect people's mental health when they don't have them. So these are the consultants. That is the secret sauce to our initiative that we had. So in order to do this program, we developed a relationship with 3 consultants, 2 of which are master's level behavioral health clinicians, as well as Ms. Tennille Hill. She is a hairstylist. She owns her own salon in Mechanicsburg, and she also is a cosmetology teacher. Then we had Mr. Curtis Miller, who is also, a master's level behavioral health clinician, and he owns his own barbershop, Ayers Barbershop here in Pittsburgh. And then Mr. Mario Brown, who is a master's level public health professional, and he did about 20 years ago, he did some work with the barbers and stylists around, prostate screening for black men. So he had that history. So we thought that that was a great combination of consultants. And so there were a couple of things that we wanted the consultants to do. One, we wanted them to develop the curriculum along with us. We wanted them to recruit the barbers and stylists, train the barbers and stylists, then do the follow-up consultations with the barbers and stylists. So as far as recruitment, what we did to recruit the barbers and stylists is Curtis, who is a barber here in Pittsburgh, he would actually make cold phone calls to barbers and stylists around Pittsburgh. He would go out and visit the shops. He would utilize social media. In addition, other people that were a part of our team also that are here from Pittsburgh that have roots in Pittsburgh in the black community, we would also reach out to our barbers and stylists that we knew and had relationships with and try to get them to be a part of the program. I will say that distrust is real, because even me as a black woman going out into some of these barbershops that I didn't know people, there was a lot of pushback and defensiveness. So really what worked best for us for recruitment was when you knew somebody that knew somebody. So if I knew my barber or stylist and I said, hey, come be a part of this program, or somebody else that knew me talked to their barber and stylist, then they were more willing to talk to us. So we did a training. So the trainings were two 4-hour training. So each training was 4 hours. The first day of the training, we really focused on behavioral health, on mental health stuff. So the first day we talked about depression, anxiety, trauma. We talked about stigma. We talked about bias and all of those things mental health related. In addition, we also trained them in something called QPR, which is a suicide prevention curriculum. And then day 2 focused on substance use disorder. So we talked to them about alcohol use disorder, opioid use disorder, medication-assisted treatment, where there are medications to help people when they're in recovery, trying to be in recovery from substance use disorder. And then in addition, we partnered with the Allegheny County Health Department, and they came in and trained our barbers and stylists on how to use Narcan and gave them Narcan to have in their shops. For the follow-up consultation, we followed up with the barbers and stylists for 6 months after they were trained as wellness ambassadors. We followed up with them for 6 months. We did once a month, we met with them virtually on Teams as a group, and we talked with them about how things were going, if there were other needs. They shared their success stories, things like that. And then we also shared additional training and resources with them. Excuse me. So we launched the Our Hair training back in October of 2022. So we actually trained 3 cohorts of barbers and stylists, total of 25 here in Allegheny County. Those barbershops span 10 different neighborhoods in Allegheny County. And if you know Pittsburgh, these neighborhoods, the Hill District, Swissvale, West Mifflin, East Liberty, Wilkinsburg, they're very, very diverse, different neighborhoods, and that was by intention. And then last year in October, we expanded into Chester County, and we trained 6 barbers and stylists in the Coatesville area of Chester County. So any good program looks at outcomes. How do we know that our program is working well? So one of the things that we used to determine outcomes were the number of barbers and stylists that we trained, that we hit the number that we were targeted to train, the efficacy evaluation, which to me is the most important part. Did the barbers and stylists think that this was worth it? Was this a good program? Was it helpful? Was it useful to them? Did it help them to talk to their clients better about mental health and substance use disorder? And then last but not least, the number of calls that we got on our concierge line that we set up. So what have we learned since we started this program? So I won't go through all of these things, but one of the first things that came out when we did our first training with our barbers and stylists was that the barbers and stylists are the people that they serve. So a barber and two of the stylists let us know that once they sat through this class and they learned about the warning signs and symptoms, they realized that they needed to get help for themselves. And there were a couple of barbers that actually said, and stylists that said, they went to treatment because of what they learned in this class. The barbers and stylists really appreciated the resources. They were so grateful for having some tools to give to their clients, because barbers and stylists are not just barbers and stylists. They become friends and family members. And so when their clients come to them and they unload on them different things that they're struggling with, barbers and stylists, they carry that. And now, because they have the resources that they need, they said that that was like lightening a load for them. It lifted a burden off of them so that they could say, I hear you. They listen to them, they talk to them, and here, call this number and you can get the help that you need. One of the other things that was important to them is that when we did our training, there were people within the training that had lived experience. So one of our community health workers who sat through the training, he had lived experience being a person that had substance use disorder and mental health disorder. The woman that came in from the county that trained on the Narcan, she also had lived experience. And so they found it very useful to have somebody there to talk about their experience and share their experience with them in the training. And then one other thing I want to share that we just did recently, some zip code mapping in all of the areas where we trained wellness ambassadors and in Allegheny County. We did some zip code mapping, pre and post training, and what we have found that there have been slight increases in African Americans being engaged in mental health services. So that just makes me really happy. And last but not least, here are some pictures of our actual wellness ambassadors that we've trained here in Allegheny County. They're holding their QPR certificates and then their wellness ambassador certificates that they get for completing the program. And so I just leave you with this, that just like barbers and stylists can be a part of the problem, be a part of the solution to the mental health problem, we all can play a part too, just by having a listening ear. Thank you.